teachers and students. My name is Angelica Castello. I'm a nursing student from Adventist University of the Philippines, and I'll be discussing the importance of infection prevention for healthcare workers. Why is it so important? Ensuring strict infection prevention and control practice in healthcare facilities is essential in order to stop the development or further spread of infection. Both patients and staff have important roles to play in protecting themselves and others. But though true hand washing is particularly effective both within the hospital and also at home. Hand may look clean, but germs are always present, some harmful, some not. These germs are often passed from person to person, either directly by hand or indirect by equipment or general surroundings. It is important that patient, visitors, and staff regularly wash their hands. Staff also use a hand foam gel for cleansing their hands, and visitors are encouraged to do this when entering the leaving all areas of the hospital. So what can the patient do? Hand washing is especially important before eating, snack, and meals, and after using the toilet, bathroom, or command. Hand wipes are available if you cannot get to a hand wash basin. If you have wound dressing, stitches, a catheter, or other attachment, try not to touch them any more than is necessary, and always wash your hand afterward. Bring only essential items with you so your bed area can be kept clean and tidy. If you have any concern about cleanliness, please talk to a senior member of ward staff or matron. So what can visitors do? Visitors should not visit if they feel unwell or are suffering from nausea, vomiting, diarrhea, cold, chest infection, flu-type symptoms, diagnosed rashes, or infectious skin conditions. It may not be appropriate to bring young children or babies onto the ward in order to protect them, and in some areas to additionally protect patients who may be particularly at risk from infection. All visitors must wash their hands or cleanse with hand sanitizer before and after visit. We ask that visitors do not sit or on the patient's bed, touch or handle by any wound dressing, medical equipment, or any other attachments to the patients. So, what will staff do? Staff will wear plastic apron and gloves will required to protect themselves and their patients. Staff will wash their hands or cleanse with hand sanitizer before and after contact with you or your accommodate surroundings. You and your visitors are encouraged to remind staff to cleanse their hand before and after a contact with you, and their are hand sanitizing dispensers within easy access to each bed for this purpose. If you have an infection or one is suspected, you may be nursed in the side room or in a bay with other patients with the same infection. Nursing and medical staff will explain everything you need to know. Or your relatives need more information about infection control measures, designated specialist infection prevention and control service within the hospital can be contacted by wire. Thank you.